I'm Mike Royer with an extended interview in this Health Matters Web Extra. Welcome back to another segment of Health Matters, and we're joined today by Dr. John McDonald, an obstetrician and the interim dean in the Department of OB/GYN here at the University of Alabama. Dr. McDonald, thanks for joining us this morning.
Thank you, Mike.
We just came through the month of October, and I think everyone knows by now that October is Breast Cancer Awareness Month, but I know it's not a topic that you don't talk about the other 11 months of the year. Women being aware of breast cancer challenges and everything that goes with catching it early is something you deal with year-round, correct?
Yes, that is correct.
What is the general advice you give women of all ages, first of all, as they think about heredity, own self-examination, mammograms? What's the general advice you give women here in 2020 when it deals with the potential problems that they might face down the road?
In general, we always encourage our patients to be aware of their breasts at all times. The reality today is that over 50% of breast cancers are detected by the patient, not by their physician. So we always encourage our patients to be aware of their breasts, and if they feel any changes, they should contact their family doctor or their OB/GYN and get an appointment for it to be evaluated.
That has to do with education, of telling young women, you need to check and feel around. If you feel something different than you felt 2 months ago, let us know about that. That percentage
Absolutely.
of self-examination discovery kind of surprises me a little bit. That must please you that women are cognizant of that.
Absolutely. Women have always been the drivers of health care. They are very aware of the challenges, and they really serve as the gatekeepers for their whole family. So women do a very good job in the detection and screening of their own breast cancers.
You're not brand new to this. You're not an old physician either, but you've been doing this long enough to see real progress in the area of breast cancer. What's the optimism that you have to share today about catching it early, about treatments and that sort of thing?
The optimism today is breast cancer is the number 2 leading cancer in females. By the time you reach age 50, you have a 1 in 8 chance of developing breast cancer if you are a female. However, in the past 20 to 30 years, our treatments, our detection rates have gotten way better. And so now, over 90% of those patients that are diagnosed with breast cancer live and survive and beat the cancer. And those are great statistics. It has not always been that way.
And women whose mother had breast cancer or grandmother had breast cancer need to be keenly aware of their own personal health. That percentage is still very high.
Absolutely. Women that have a close family history of breast cancer should always ask their doctors whether or not they may have a hereditary component, which the most common one is the BRCA1 and 2 gene. That's very important to detect in patients because if you do have that inherited gene, you have about a 50 to 80% chance of developing breast cancer in your lifetime, which is much greater than the 12% in the general population.
And that percentage, that test that finds that gene is simply a blood test?
Simply a blood test.
That's all it is. So that's a simple thing to do, but can sure save lives down the road.
Absolutely.
Is it age discriminatory as well? That you said earlier, by the time you reach 50, your chances go up. Does that continue on into 60s and 70s, or is the 50 age group kind of a peak period for finding this?
The decade of your 50s and 60s is the prime time for development of breast cancer. We have had women as young as 20. Those are usually the ladies that have the familial or inherited gene for that. But by far, the vast majority of patients really need to be vigilant in their 50s and 60s.
Talk about end results. I assume, and correct me if I'm wrong, a lumpectomy might be, well, no treatment might be the best thing, but a lumpectomy is fairly simple and maybe a little bit of radiation. A full mastectomy is still, I assume, the extreme, but even with that these days, survival rate is better, reconstruction abilities are better, so you don't want anyone to get breast cancer, but there's much better outcomes now than there were when you got into the field, correct?
Absolutely, and that is really the challenge that we have with COVID right now. Back in March, when the hospital here actually shut down elective surgeries, you saw it become a challenge for our ladies that had developed breast cancer to get those surgeries that would reduce the tumor mass and then get their reconstruction at the same time.
Yeah.
It was easy enough to justify the surgery to take the breast off. It was more difficult to justify what the, for lack of a better term, the healthcare workers felt that the reconstruction of the breast was more of an elective procedure that could be delayed due to the COVID and the risk of getting that.
We'll save the argument for another day, but I'll bet
Absolutely.
you and women who have to go through those extreme surgeries would certainly argue about that being cosmetic or elective.
Yeah, absolutely. But you never want to delay surgery for someone if you can help it. But COVID is a unique situation.
And we'll talk about that more in another segment coming up. Dr. John McDonald, thank you so much for your time today. We've enjoyed having you.
Thank you, Mike. I appreciate being here.